even with my own dogs, I have one where she's 13, she's only needed 2 cleanings her whole life. And then I have another little dog where she can have them every, like once a year or once every 2 years. Like she just doesn't have great teeth. Sometimes you can get away with not needing one until a few years later. Sometimes it's that following year, just depends. The actual cleaning itself is probably only anywhere from 15 to 30 minutes, versus if you wait and don't do cleanings earlier in their life and they end up needing a lot of extractions because they need periodontal disease, the procedure can last 3 to 4 hours sometimes. We always say that age isn't a disease as long as their heart is good. So when we listen, there's no murmurs, there's no arrhythmias. And then blood work. We do blood work before every anesthesia event, checks their liver and kidney values because that's what they use to process the anesthesia. So really, as long as those 2 things are fine, the risk of anesthesia is less than 1%, just like it is in people. People always say, oh, well, my dog and cat is still eating. And a lot of times, I mean, they'll eat even if their teeth are rotting out of their mouths. It's pretty gross. They'll still eat, but it doesn't mean that they don't have oral pain. And I just hate the thought of them. I'd rather them not have the teeth than have chronic pain. It's a huge source of bacteria that's really bad for their heart and their kidneys. So leaving those teeth that just have all that yucky tartar on it, that seeds, that goes into the bloodstream and can just be really bad systemically for them.
So what I use is a product called TD, which is made by Hill Science Diet. They're these like unnaturally large kibbles that on the outside, it's all greasy and flavorful and delicious, but on the inside, it's all made up of these crisscrossing vegetable fibers that act as the bristle of a toothbrush. So anything beyond the canine, it's just going to brush their teeth twice a day by just adding a couple of these into your pet's daily meal. Pick a time of day, every single day, and every day you feed them a tiny little dollop of chicken, beef, peanut butter flavored toothpaste on your finger. So then you're creating this really positive environment. And eventually they'll start realizing, okay, every day at 5 o'clock, I get my peanut butter toothpaste and it's so delicious. So at that point, you'd switch it to the toothbrush and they'd lick it off the toothbrush. So now you're taking this positive reinforcement of the toothpaste and getting it into the positive reinforcement of the bristles of the toothbrush. Then it's really easy to just start to move that toothbrush over the teeth. Eventually they get used to it and they start to get excited about getting their teeth brushed because they're getting their treat essentially. And then if the TD is taking care of everything behind that, then we usually don't end up seeing that patient on the dental table for the rest of their life if they continue with the at-home dental care, which it really all starts at home anyway. So.